All right, guys, Luis Moreno here with 360 Insurance Group. And today we are less than a week away from open enrollment, which starts November the 1st. So exciting times. And I was contacted by Health Sherpa. Hey, we want to do an OEP training. And I was like, hell yeah, let's get this thing going. So let's get into some good training here, guys. We got exciting things happening. The biggest thing, I guess the hottest news right now is the family glitch is gone. So maybe if you can touch on that, that'll be great because it's going to give us access to it. 5 to 6 million new people that could possibly get ACA plans. So guys, we're going to dive into this thing. So with that, go ahead and take over. It's all yours.
Awesome. Thank you so much. Hey, everybody. Thank you so much for being here today. I'm super excited to be working with all of you. And if you're not new to Health Sherpa, thank you for working with us. If you are new to Health Sherpa, lots of exciting things today. We'll go over kind of some basics, and then the intent of today is really to prepare you for open enrollment. So I've shared this presentation with Luis, and he'll be able to send that out to all of you after today's call. I'll make sure to also share a bunch of additional resources with you. But let's just keep this conversational today. So if you have questions, feel free to ask, and we will make sure that we can cover everything in here. A couple of things that I will add is this is not a new agent training today. We're going to go over some core pieces that Luis and I agreed would be helpful to prepare you for open enrollment. But if you haven't used Health Sherpa before, make sure you sign up for a new training with our team. I'll make sure to get that link out to you. We've got a ton of resources again, so don't be afraid to ask. So my name is Jordan Dodier. I'm our Director of Agency Sales here at Health Sherpa, calling in from Denver today. It's our first cold day of the season, which is why I'm all bundled up. It's very cold in my office today, but super excited to be working with all of you. And so let's just kick this right off.
And guys, before you start there, Jordan, hey, do me a favor, guys. If you all have questions, type them in there, and when we have some time, I'll go ahead and I'll hit Jordan up with all your questions, but please ask away, guys.
Awesome. So here's our agenda for today. We're going to spend a few minutes talking through account setup. So again, if anybody is new, we'll talk through what that looks like. We'll talk through getting started. I've got, again, lots of resources in this deck. We'll go through a quick quote to show you what quoting on Health Sherpa looks like and how easy it is. We'll do a test application on our staging environment. I will add just a quick note here. CMS was experiencing a couple of issues this morning. So I'm hoping that our staging environment cooperates with me today. If not, we'll be able to walk through that in some slides. And then we'll talk through a couple of unique situations. So I know you always get approached with unique family situations. So we have some common ones to talk through today. We'll talk about the family glitch. The good news is for all of you, it's actually quite simple with Health Sherpa. And then lastly, we'll wrap with some customer management tools and then resources and troubleshooting for all of you. All righty, we're going to jump right in. So account setup. So if anybody is brand new to Health Sherpa, you'll want to go to healthsherpa.com and click on For Agents up top. And then once you click on that, start enrolling faster. Again, this deck will have healthsherpa.com and the link to do so. I'm going to kind of breeze through these here. You're going to sign up for a free account with your email password. I will note that it is always free. You don't have to pay us to use Health Sherpa. No matter what you use on our site, it is free to use. And then you'll go through some basic information. So your first name, last name, company name, phone number, how you heard about us. And then you have a few options in terms of accounts that you're creating. So we support just independent agents. You can create an agency if you have agents that work for you. You can also join an existing agency. I will add that if you have an existing account, and let's say you were linked to an agency and you need to leave an agency, maybe you made a mistake during account creation, contact our support team and we can make any changes on the back end if needed. So if you click the wrong thing, or if you have an old account and need help with it, we can help you with that through our support team. And again, I'll share how you get in touch with them on our call today. So then there's another section when you create your accounts that's asking for the states that you're licensed and the carriers that you're appointed with. My personal opinion is this is easier to do from the settings of your account. But again, you can do it during account creation. Just know that our site will check to ensure that you're licensed in a state before allowing you to write. you are required to update the carriers that you're appointed with. So again, we validate the state, we don't validate the carrier. So you need to make sure that you do that. Again, I'll be sharing some additional resources today that show you where to go to do that. And if you ever get stuck, just call us. HealthSherpa also offers a referral program. So just at a very high level here, let's say you're writing in Texas and you're appointed with 3 carriers out of the lots of carriers that are in Texas. You do have the option to refer those to HealthSherpa, and we would pay you a one-time fee. There is often a lot of concern from agents. Is HealthSherpa going to steal my clients? Is HealthSherpa going to contact my clients? This program is designed for you to be able to support your client with a plan if you are not appointed with that carrier. Let's say you get the appointment, go ahead and submit that with the carrier for the commissions. If you want to sell them other products, sell them other products. We're not going to contact them. We don't do anything besides ACA here. So again, this is a program intended for you. You have to turn it on during account creation in order for it to be enabled. There's also a referral section of your account where you can control this at any point in time. Again, if you make a mistake with HealthSherpa and you submit something as a referral on accident, call us. We can walk you through how to fix that. We also have reporting to help you track how you're submitting everything to make sure that things are going through the right way. So that's our referral program. And then there's one compliance section during account creation as well, where you'll be asked to enter in your FFM username. So this is the same as your portal.cms.gov login and your NPN. On the FFM username, one very important piece is that CMS does require you to reset that password every 60 days. If you get locked out of that account, you can get locked out of HealthSherpa. The last thing I want to hear is an agent gets locked out of our technology on like December 14th or 13th, and this happens all the time. So go in, make sure that you can log into your portal.cms.gov account, make sure that your password is good, and then put a reminder in your calendar so that you don't forget about that. We want to make sure that you have access to this technology during the busy season. It's going to make a big difference for you. But during account creation, once you enter that in, you'll just click continue. And what we're going to do is perform a NIPR check. So we're just making sure that you're licensed, and we're validating the states that you're licensed in as well. Once you submit that, you're good to go and your account has been created. I will point out that every agent has to have their own account. So you need to do your own account creation. Again, if you've got a unique setup, feel free to contact us and we can walk through that. But there's one other important piece to getting your account ready to go, and that's enabling EDE. So that's this button up top. And for anyone that's new, EDE stands for Enhanced Direct Enrollment. Let's see, I don't have a slide on that. But basically, this is the technology that connects HealthSherpa to the federal marketplace. So without this technology, you're missing out on all of the tools that we have that make submitting applications and managing your clients that much easier. So again, create your account, click on this button. You'll be asked to verify your identity. You only have to do this once. So again, it's going to ask you a couple of questions from CMS's credit partner. It's not going to check your credit, but it's those crazy questions like, in what state did you register your first car? Like, nobody knows where these questions actually come from, but just answer them to the best of your ability. If you do fail them, which does happen, contact our support team and they can manually override it for you. But of everything that I tell you today, if you're new to HealthSherpa, this is the most important part here, is clicking this enable EDE. And then I will add, just if you've recently completed your FFM certification, it takes about 48 hours for this button to appear after you create your account. So just be patient. If you don't see it yet, it will pop up. And then once you do it, you're good to go.
Hey, Jordan, one thing what might be good to address also is I'm noticing, at least for me and a lot of my producers, they're having to reintegrate their FFM.
Yeah, good question. So we'll talk about that here. So I've got a getting started checklist. I'm not going to go through all of this in detail, but this is a new resource that our team put together. This year it's in English and Spanish, but if we open this up here, you'll be able to see that we talk through all of the important things that you need to do with your account prior to writing with HealthSherpa. So you can see there's a section in here that talks about the FFM integration. And then you can click on the FAQ here. But just for context, for anyone that's new, integrating your FFM account can be found in this settings tab of your account. This is new this year. And what this is perfect, is right here. So in the past, Health Sherpa would connect to the federal marketplace through just this username. This year, CMS took over that validation process. So that's why all agents are required to integrate their account now. So if you haven't done it yet, you're going to see this little red 1 icon next to your settings. Just go ahead and click on settings, come in here, and then in this section, it'll ask you to validate. So you just click that button and it does it. So all that you have to do is that one time. If you don't log into your account for 30 days, you'll have to do it again. But if you're logging in, on a pretty frequent basis, which I can imagine you will be during open enrollment, you won't have to do it again. If you have any issues with this, again, contact our support team and they can walk through that with you. It is pretty new. So if you experience an issue, just contact us and we can help you with that. So again, definitely check out this agent checklist in here. If you have any questions, my contact information is listed in this presentation, as well as how to contact our support team. We are here to help you. So really ask us anything, but definitely take a look through that checklist. There's also a link to register to our upcoming trainings in there. And I'll make sure, Louise, that I send you all of these links in my follow-up email today as well. All right, so we're going to jump right into quoting. So a couple of things to know about quoting before I show you an example is it's found in the top right corner of your agent portal. I've got a YouTube video about how to quote on Health Sherpa that you can save as a reference, but I think you'll find it's very simple to do. And you have the ability to quote on exchange medical as well as dental. Just keep in mind you have to do the dental with the medical plan. We have some off exchange plans. So we are expanding that footprint. Again, those are direct with the carrier. So you can do those right from the quoter. And this year is the first year that we'll be offering off exchange dental. So our team has a lot of resources on these. I'm not going to do a deep dive into dental, but if any of you are interested in learning more about off exchange dental, definitely feel free to reach out and I'm happy to share those resources with you. We're doing UH1, otherwise known as, I think, the Golden Rule Insurance Company. Right. And that is in about 5 states. Texas is one of them. And we're also doing Blue Cross Blue Shield of Arizona. It's just those carriers for right now. But again, happy to share some resources with you if you're interested in learning more. So I'm going to just jump back into our staging environment here. So this is a test account. All of the information in here is fake, but it does look exactly like the Health Sherpa actual production site. So this blue button up top is where you'll find the quoter. So this is what you would want to do is just click on quote Onyx or use the drop down if you need to get to dental. It will point out that you cannot do an on-exchange ACA plan in addition to an off-exchange dental plan. We are required by CMS that those are separate applications. You can know that doing off-exchange dental with Health Sherpa that you'll still have a streamlined application. But knowing that that's our first year doing that, if you have any feedback for our team, certainly feel free to reach out and share that with us. So I'll just do a quick test quote here. I'm going to use Phoenix as my example. So as you can see, we're just collecting some basic household information. So we could do 1 or any number of household members. We can use age or date of birth. This was new last year. This is really nice because now you don't have to do the calculation in your head, which I can never do on the spot. So quick toggle for male or female. And then as you can see, you can select down below if they're a tobacco user, parent of child under 19, if they're pregnant or eligible for other coverage. The nice thing with Health Sherpa is we're not going to ask you to fill out sections if they don't apply. So you can see we're not looking for a spouse or dependents unless you indicate that you have one. So we try to just keep it really streamlined. And based on this basic household information, the site is already going to tell me what sort of eligibility this client would be eligible for $220 a month of savings and a CSR. And if we scroll down to the plan results, we can see all the plans that are available in the zip code. So a few things to point out in this quoting tool is you've got some filters over here on the left. You can see if a doctor or hospital is in network. This is a great tool. You can do the same for prescriptions, and it'll actually just show you right on this plan card whether or not that provider or prescription is in network. So it's either going to be green or red, and it'll just point blank tell you. We've got some usage estimates. So helpful if you're working with a client that just doesn't really know if they're considered low, medium, or high use. So try to help you figure that out. And then let's say you want to filter by just the carriers that you're appointed with. You can do that here. I will point out for any carriers that are exiting the market this year or entering the market this year, those will be effective as of November 1st. So just keep in mind what I'm showing you is our test environment here. So then some other filters, if they're eligible for an HSA, metal levels, maybe we want to look for just silver. And then you can compare up to 5 plans in here. So this is really nice. You can pull up a great side-by-side comparison. And just last week, we actually fixed this print button. So if you've used HealthSherpa in the past, you know that when you click print, it didn't look so great. So now it's a really beautiful side-by-side comparison that's going to include the household information on one corner and your information on the other. So if you print this off for your client, they know how to contact you. They've got all of this information right on one nice clean page. And again, we try to give you all of the resources you need right at your fingertips. So we can come in here and pull out the summary of benefits, prescription directory, all right from this page. You can add one of these plans to the cart and start the application from here. You can email this off to your client. One of the nice things about doing it this way is if they click on the link included, it will bring them right back to this page. And let's say they enroll in this plan, it will attach your NPN to that. So you will get credit with the carrier for that enrollment. And if you send it through here, they'll be saved as a lead in your HealthSherpa account. So you can work through that lead section of your account and say, okay, I sent this off to Joe. He hasn't enrolled yet, so I'm going to reach out to him. I do work with a lot of agents and agencies that will actually take this link out of here and send it through their own mail tools. Maybe you've got tracking so you can see if they've opened it or click on it. I have heard some feedback that this link is quite long. I'll show you. So if you have any issues copying and pasting this, one of the little tips that I've heard out there is that you can just Google like a URL shortener, and you can just pop this into Google, and then it'll give you just kind of a short URL. So you could put that in your own email campaigns as well.
Yeah, and I'll tell you guys, I have run into that issue quite a bit. I'll send it and they're like, I'm not clicking on this thing. I don't know what I'm getting myself into. And so, yeah, Bitly will work. And I think there's some other plans out there that, or some other programs out there that will shorten that thing for you.
Yeah, absolutely. So those are some of the tools you have here in the quoter. Again, if you add any of these to the cart, it'll just drop you right into the application. If you're looking to add the on-exchange dental, it's in this tab here. Again, that has to be combined with a medical plan. And then you'll just drop right into the HealthSherpa application, which we will do an example of. And I think that might be our next section here. Okay, so just to keep this streamlined, let's just say we're going to pick this Blue Cross Blue Shield of Arizona plan here. So we're going to add this to the cart. So again, if I wanted to add dental, I would click continue shopping and go to the dental tab. But here I'll just click start application. And I got this to work for me right before this call, so I'm hoping it cooperates, but if not, we'll make do. So one of the examples that Luis thought would be helpful to go through is a split policy, or a, as we would call it, multiple enrollment group. So last year we gave you the ability to group different family members on different plans. And we typically would see that if like one family member has different health needs than another, and they obviously don't want to pay the premium for the whole family to be on one particular plan. So I'll show you how we do that today.
While you're typing that, Jordan, got just 2 questions. Will you be able to share some of the off-exchange dental plans that are available?
In terms of the states?
Yes, for Texas.
I can get you that list. I don't know it offhand. One of my colleagues has been running that initiative, but I'm happy to share that with you after our call.
Okay, perfect. And then next question I've got here is, will some carriers allow enrollments without Social Securities?
Yeah, great question. They do. I'm going to actually do that as this example here. So I'll show you what that looks like. And I realize I'm using Arizona. I just always use this for my testing because I can talk and type it at the same time, but it should be exactly the same in your area as well, minus obviously different carriers. So we're going to say, yes, we're looking at cost savings, and let's say we're going to add a spouse. click save. As you can see, really simple to add somebody else to our application here. Yes, jointly, no dependents. So it's just going to ask us the same questions for the family members here. So we're going to say no social, since I'm giving an example here and I'm not going to share my social on a recording, but I'll show you what that looks like when we get all the way through this. Not in jail. CMS really did a pretty big push in this past year to really try to understand health equity. So that is why we ask these questions on the application. So although I'm clicking decline to answer here, if you feel comfortable asking this of your client, this is just really helpful for them to understand the populations that are being reached and how to work on marketing to those areas. So again, if you're comfortable asking that, please feel free, but know that you have the option to decline. One of the other helpful tips for Health Sherpa is these little question mark icons. So if you're ever not sure how to answer a question, feel free to hover over one of these and you can see there's a pretty long description here. The other tool that you have access to is our agent support team. This team is so knowledgeable. They get questions about the application all the time. I can tell you that I go to them, my team goes to them. They understand all these complex cases. If they don't have the answer, they'll find the answer for you. And if you don't get the answer you want from them, just ask to speak to a supervisor. I know some of these support reps will even like call into the marketplace with you. So just know that you have all of those resources available. And we'll go through this a little bit later, but don't call the marketplace. You're going to sit on hold forever. Call our team first. Last open enrollment, our average wait time was less than 1 minute.
And I will also tell you that your chat feature is also great.
Yeah, absolutely. I've helped with chats. I can tell you that they're managing a lot with chat. So if you have an urgent issue, if you're working with a client, feel free to call them too. But you can chat instantly as long as they're in the office. Their hours are 6 a.m. to 5 p.m. Pacific Standard Time, Monday through Friday. The last 2 weeks of, normal open enrollment. This year it'll be obviously extended, but December 1st through December 15th, we definitely ramp up those hours and staff as well. And typically the last couple of days, like December 14th, will be open pretty much around the clock. All right, so we're going to put in some employment information. So as you can see, there's some different frequencies here. So if they have a hard to predict income, you can choose, whatever frequency you want. Again, we're asking you to confirm with them that the income information is correct because this is how the APTC is calculated. Very important that that is as accurate as possible. We'll say that the spouse for this example does not have any income. And then we go through some extra help questions, like if they've got any disabilities or if they've been denied Medicaid or CHIP. We're going to skip through this. We're going to say that they're not currently enrolled. We do have the ability to have HRA information or if they've been offered an ICRA. I'm not going to go through that for this, but we do have some resources if you're serving any of those clients. Again, employer-sponsored coverage. So this is where the family glitch piece comes into play. I've got some slides on this in a bit, but what you would do is, let's say Joe is offered the employer coverage and Jan is his spouse. You would just select that Joe is. We'll go through this. I don't know if it's live and staging yet, but essentially you'll put in the lowest cost premium for Joe alone, and then you'll put in what the total premium for the family would be, the lowest cost for the rest of them. And the site will actually do the calculation of whether or not it's affordable for them. And then we'll calculate what that subsidy amount would be for the family. So hopefully it should make it really easy for you. Obviously, you'll need to collect a little bit of information from the employee about like what those premium prices are, but Health Sherpa should make it very simple for you to be able to do that.
Hey, Jordan, I'm going to add a couple of things because I have been researching the heck out of this glitch thing. So there's going to be two, just like there's going to be the employee only portion to the glitch and then the family portion to the glitch. So know that the glitch could help the family, but not the employee.
Yes.
Okay, so that's one thing. And then the good thing is that with Health Sherpa, you guys are going to do the math. We're not going to need to do the math, right?
Yeah.
Okay, and that's a beautiful thing, guys. And I have some other videos that I'll be doing where I'll be sharing the math with you, just so you can have a comprehension of it. But again, when we answered yes to this question, these insureds, the spouses of these employees, were completely out of luck. There was no subsidies available to them.
Absolutely. So we're in the employer coverage section. Again, take advantage of the resources our team has for you. If you have a question related to policy or some sort of change, just because it's not the application on Health Sherpa, just call us. We're happy to answer it for you. And if we don't have the answer, we'll find it for you.
And now the one thing that you guys won't be able to find is you're not going to know what the lowest cost plan is going to be for that employee and for the spouse. So know that when you're communicating with these insureds, they're going to have to go to their HR, whoever handles their insurance, their group plan, their employer plan, and they're going to have to ask those questions. That's the only way to know, because it varies from one carrier to another, from one company to another. There's not going to be a flat number to that.
Absolutely. And as you mentioned, Luis, this is a huge opportunity. There's a lot of folks that this is really going to positively impact. So either their family is not insured today, or they're just paying a lot of money for their coverage. So you talk about a great way to get additional referrals. Like, you are doing such a positive thing for these employees, families. So a really exciting change that we're super excited to support this year. So moving on here, because it's still special enrollment, I'm going to put that this example is going to lose coverage this month. But just know that with Health Sherpa, so for example, if they were under that 150% FPL, or let's say they had the COVID SEP, we skip past that. Again, during open enrollment, you won't have to indicate a special enrollment either. So because of the things that I'm filling out here saying that I'm eligible for an SEP, the marketplace might require additional documentation. During open enrollment, that does not apply. So then we get to the finalized page. We'll want to review that everything looks correct here. And then we click continue. So a couple of sections here to point out. Renewal of coverage. This allows them to passively renew for up to 5 years. We are seeing a lot of agents actually do I disagree here and then click don't renew. That's really your preference. The reason I'm seeing a lot more of not passively renewing is because there are carriers entering and exiting the market. It's obviously in the best interest of the client for you to be contacting them, making sure that there weren't changes, making sure that they didn't have health changes throughout the year, and ensure that they're in the best possible plan year over year. Now, let's say you do have I agree. That doesn't mean that you can't go in and submit a different plan for them, but it will auto renew for the first of the year if you do not, or sorry, if you click I agree. And then just a couple of tax attestations here that you'll want to read off to your client. And again, because you've enabled that EDE technology that I was talking about early on when I said that's the most important part, this is the EDE application. So this is what makes Health Sherpa really unique, is that you get to do this nice streamlined application and you can e-sign on behalf of your client. There's no identity proofing. It's all able to be done kind of right at your desk. It's streamlined, it's optimized. It's supposed to be as efficient as possible for you. So this site, again, operates a little bit slower than our real site. So keep in mind we're on our test site here, but now we're pulling in eligibility results from the marketplace. Let's say that the client says, you know what, I'm getting another phone call, or I have to go pick up my kid or something like that. Click Save Lead, and the site will save your progress wherever you are. So if we click that, they'll be saved right into your Health Sherpa account. You can resume where you left off and not have to re-enter all of this. So here we can see from these green check marks that Joe and Jan are eligible to enroll, and we can see all of the detail here. So they're eligible because of a special enrollment period. So I did loss of coverage, eligible for a tax credit, eligible for lower deductibles, out-of-pocket limits, and copays on silver plans. And then we can see the follow-ups required. This is super important here as well. So loss of coverage, that's how I was able to qualify for that SEP. So in CMS's eyes, this is what's called a SVI follow-up. And then these two here, income and citizenship, are DMIs. So these are documents that you're required to provide in order to get the subsidy for this client. So because I didn't do a social, we have to do the citizenship. And I'll show you what that looks like in a little bit. So we can see the total monthly tax credit here. We can download the eligibility letter. We have to do that before we can proceed. And then, you know what, I'm so silly. I did a family here and I wanted to show you what the split plan would look like. You have to start with the application to do the split plan. I don't think I can, okay, yes, I can. So we're on the confirm your plan page and let's say, oh shoot, we actually want to put them on 2. We're going to scroll down to the bottom of this confirm plan page. It looks the exact same way if you start from the application and you click on shop multiple plans. The reason we call this multiple enrollment groups is because you can see here we can group family members. So let's say you've got spouse and 2 kids you want on one plan and then the other spouse on a separate plan. You can do whatever groups you want. So let's say, Joe, we're going to choose a plan. We're going to stick with, let's just mix it up here. We're going to add this United. And then for Jan, we're going to choose a plan as well. And we're going to go with Oscar. And now we're able to, you can see here, we've got the health plan selected and we can continue. So now we can see the 2 different plans. We can apply all of the savings. NPN override applies. Some agents are part of agencies that will write with like a principal NPN. Maybe you have some agents that work with you to help submit some of your business during the busy season. NPN override is a feature you can use that as long as they're licensed in the state, they can write with your NPN. So for more information on that, either you can look that up on our FAQ or you can reach out to us and we can share more on that. But we'll click enroll in these plans. And now this is being submitted off to the market. Oh, sorry, I forgot to select something. And now it's going to be submitted off to the marketplace. So once we submit this off to the marketplace, again, your NPN is going to be attached to this. You don't have to enter that at any point in time. We're going to be brought to a success page that will tell us what needs to happen next. So that's really important for you to review with your client. You can find all of this information right from Health Sherpa as well. But one of the things that we like to share is that this information, if you collect an email address for your client, it does send them an email letting them know what they need to do next. So we talked about those follow-ups, like providing proof of loss of coverage, proving citizenship, and the other one was verifying income. The client is going to get an email saying, hey, take care of these follow-ups to make sure that you stay covered and that you get your subsidy. So they're able to actually create a consumer Health Sherpa account where all they can see is their plan information and they can upload those documents. Let's say they have a premium to pay as well. They can make that first binder payment on Health Sherpa as well. So you can let them know to look out for an email from Health Sherpa. It's going to look something similar to this page with a call to action saying, create an account. But what you need to know is if you scroll all the way down and you click on go to my dashboard, this is going to bring you into a page that shows you all of the follow-ups for that client. And apologies, this site has been loading a little slow recently. It is not on our actual site, just the test environment here. But this is what we would call the client detail page. And the way that you get to this page is when you're in your client section, you can search for the client name and then you click on the client's name down in the table below, and it'll bring you to this page where it'll tell you. So we can see all of the follow-ups here. So if we click on verify, we can upload the document. So you can select what document it is. You can see which documents are acceptable. So if you're not sure, we're going to tell you what you can upload. We actually even had some instances last year where I think agents were having a hard time getting the required documents. CMS even has attestation forms that say like, hey, I've been working with my client on getting this information. They just don't have access to it. maybe they moved and they lost it, or like very unique circumstances, like there was a fire or something, they can actually sign an attestation and you can upload it so that you have something. So I would say if your client is saying, I'm working on getting it, either get them to sign an attestation, contact our support team and find out what you can do, or you can contact the marketplace and find out what sort of options you have. Don't just do nothing. So that's in the follow-ups. Again, if there was a binder payment due, you would see a pay now functionality. I will point out that some carriers require payment information even for $0 premiums. So definitely make sure that you click into that. Again, the reason they might collect payment information for a $0 premium is, let's say their subsidy changes or their information changes during the year. This would prevent them from losing their coverage. And obviously you can just kind of explain that to your client, like you're not going to be billed anything, but the carrier just requires that information. You can always call the carrier to confirm that as well. And right from this page, we can scroll down, we can see some basic application information. We can report changes throughout the year if needed. And then we'll be able to see the plans that they've enrolled in. So again, if you need to contact the carrier, we provide the carrier phone number. We'll provide the carrier payment phone number. So if your client doesn't want to pay online, you can just call them. And then we'll give you up to 2 years of enrollment history, your eligibility determination. This is helpful because you know, clients get a lot of information in the mail or maybe emails and they get confused. So the best practice is letting them know if they have a question to call you. Don't just upload something or make a change on their own. Don't go onto the marketplace, just call you. You can come in here, you can see what notices were sent out and you can say, okay, yeah, I know that they asked for this documentation, but we already uploaded that, so you're all set. And then just another quick tip is you can put some notes in here as well. So let's say you know that they've got a baby due in February, maybe write that in here. And then if you are using the Health Sherpa reporting, the most recent note is going to come out. So then you can use that report to say, okay, I know that I need to follow up with Joe in February because they've just had a life change and I want to see if this plan is still the right fit for them or if we need to change it. So just a quick note again, how we get back there from the client section. If you've got a large book of business, use the search bar. Otherwise, you just click on the client's name down below and it'll bring you into the client detail page.
Hey guys, one of the things that we're doing with that notes is we're putting on there. Now I have a CRM, but for those that don't, you can put on there what else you sold them. If you cross-sold them a dental and vision plan, if you cross-sold them an indemnity plan, you can also put your notes on there on when you let them know that that there are some documents that need to be submitted. A lot of times I get angry calls from my insured saying, why did my rate go up? And not only does Health Sherpa send 3 emails to our insureds on different days, letting them know that they have these required documents that they need to upload. But then I'll get a notice here where I'm like, you all never told me. I'm like, well, I know Health Sherpa told you. I even think healthcare.gov themselves are calling our insureds asking for these documents. And then I'll put on my own notes. Look, I called you and I sent you an email letting you know that we needed this documents, because they get very angry that their rates went from X amount to whatever amount is without that subsidy, since they didn't submit the required docs. So utilize that note feature.
Definitely. And you know, I don't have this included, but it's important. So we're going to go over it real quick. So I had mentioned our reporting. When you are logged into Health Sherpa, everybody has access to this export button here. So if you click on this, you're going to be emailed a report that has your whole book of business. The best thing I would recommend, and I'll make sure to include this in the follow-up, it's definitely in the open enrollment prep guide that I talked about, but our reporting has a ton of detail in it. So in our FAQ, there's something called the Excel file legend. This report can be a little overwhelming. There's 150 columns in it. And so when you open it, you're like, oh my gosh, what am I going to do with all of this data? Well, it's going to give you all of the primary contact information. So you can compare that against your CRM if you're using a CRM, but it's also going to tell you things about the application as well. Like, did you submit it accidentally as a referral? Did you use an override on it? Has the premium been paid? Here's an important one, follow-up documents. This is pulling real time from the marketplace. Action needed, processing, insufficient. So keep that in mind. And then some other helpful ones to point out in here. Sorry, I realize I'm moving quickly, but I'll make sure you all have access to this, is there's some columns here called DMI outstanding. So I mentioned this earlier. DMI outstanding are those documents that need to be uploaded. If there are expired DMIs, that means they lost their subsidy. You got to contact these clients and let them know that they lost their subsidy and work with them to determine, can you get those documents? You contact the marketplace and potentially fix that. And then SVI is the special enrollment verification. So again, this report will tell you if you have any outstanding or expired. This is just one tool you have access to ensure that those follow-ups are taken care of. So again, this is from the export report. You find it just off of this export button here, a great tool to use throughout the year.
You guys, I'm going to just reiterate, you have to use these tools. Your insureds, a lot of times when I enroll them, I push for all those documents. If I'm missing socials or green cards or pay stubs, I like to tell my insureds, bring everything with you, even your tax return, because you never know. Now, we are getting to more of a telesales type of system with ACA. So if once you enroll somebody, you're going to know immediately what documents they need. Don't hang up the phone without telling those insureds what they need. Okay.
Yeah.
And I would say scare them. Look, your rate is $10, but if I don't have these documents, and I wouldn't even give them the deadline that they have, knock it off, knock off 2 or 3 weeks off that deadline, because people will wait to the very end. So you'll notice here with Joe Kim, documents are due November 23rd. Well, shoot, I'm going to tell them, hey, I need this in November, by November the 1st. Otherwise, we're going to have a problem. And here's what your problem is going to be. You're either going to lose the coverage, or instead of your rate being $10, it's going to be $1,000. And I can't help you. I'm not going to fill out that there's a claim form. I don't even know what form it is, but I am not going to spend all that time to fill out a form that that due to your actions, I'm not going to waste my time on it. Now I'll hand it to you and you can fill it out and send it in, and good luck. But my recommendation is don't give them these dates. They are going to get an eligibility letter and they're going to get a notice, but you're with them on the phone. Hey, Joe, right now, I want you to email me, or better yet, take a picture, use your phone, take a picture of this loss of coverage and text it to me. Your income, go get me your pay stub and take a picture of it. Okay, your citizenship. Hey, I need your certificate of naturalization or your certificate of citizenship. Take pictures and send them to me right now so we can satisfy this requirement and move on.
Absolutely.
You work hard to get these leads. We paid money for them. Okay, and losing them because they didn't submit this is not a good thing.
Yeah, absolutely. Another tool that you have access to in your settings, again, lots and lots of resources with HealthSherpa, this follow-up document email. So as an agent, you can get an email every day that lets you know any changes. So letting you know if you've got a client whose expiration date is coming up soon on documents, or if there was a change. It's going to tell you everything that happened in the last day. Doesn't hurt to have it on. I know you all get a ton of emails, but then you can just give it a quick glance to make sure, hey, I'm not overlooking anything. And then here's that other one that Luis was mentioning, the follow-up documents for clients. Sent 15 days, 5 days, and 1 day before the deadline. So you want that turned on. You can view what the email looks like here. It's just letting them know what they need to submit. And then it's going to tell them, how to contact you to get that taken care of. So again, lots of tools to try to make sure that, we're enrolling as many clients as possible, keeping them covered, helping you manage that book throughout the year. All right, so we'll jump into a couple of unique situations here. So we just did the multiple enrollment group, otherwise known as split policies. I've also included the FAQ here in case I was jumping around too much, or in case you just need to read that. Feel free to check out that FAQ. So I did talk to our support team as well about child-only coverage. And what they shared is that it really can be dependent on a case-by-case scenario. So you'll want to fill out the family's household information. And then the eligibility letter will tell you kind of what they are eligible for. And if you're not getting what you need to, they recommended calling the marketplace call center. Sometimes those applications have to be done directly with the marketplace. So, obviously we want to let you know that you can do everything possible on Health Sherpa, but there are those unique situations where they have to kind of bypass the system and do it for you. So certainly feel free to check us out first. You can call our support team too, and they can try to guide you through it. But just in case, I've included the Marketplace call center's number in here. And then if let's say we've got a married family with a college student, you can check out this FAQ. This is right from healthcare.gov here. But basically it's reliant upon the tax household. So you'll put in the tax information. You'll say that the student is not applying for coverage. And then you'll do the same thing with the student. You'll say that they are part of the tax household of their parents, but with the zip code that they are in school. And then you'll be able to pick the different plan for the student. Let's say they're out of state. So then you can pick that plan for them, and then the parents can be on a separate plan. So I want to pause here before we go into the family glitch. Any other unique situations that I can try to answer for you?
You know what? And I will tell you guys, call them up. I try to avoid calling them as much as possible. I also I tell my insureds, whatever you do, do not call the marketplace. I mean, those people are not agents. They're clerical people. They're processors. So I would say stay away from them as much as you can. Recommend that your insureds don't call them. The multiple enrollment groups, those seem to work on Sherpa when they're in the same city or not, when they're in the same state. I have run into some scenarios where one is out of the state and there's no way around it. You're going to have to call the marketplace and get that done. But you can call them, guys. There's nothing wrong with them. You as the agent can call, have your insured on the phone, have your insured authorize you for an entire year. I think that's the maximum that you can do. And then they can hang up and you can complete the application. And you got to tell those reps at healthcare.gov, make sure my agent information is in there. Make sure that you're plugging in my NPN, because you will still get paid for them. Okay. But if they don't put your NPN, you're not going to get paid.
Yeah, that's a great tip. Absolutely. And again, save yourself some time and some frustration. Call our team first, exhaust the options with our team. And if they say, okay, you have to call a call center, then you can take that step. But the last thing I want to recommend is, calling somewhere and waiting on hold for 4 hours and not getting the answer you need. So can definitely be dependent, but our team gets asked these questions all the time. So reach out if you're not sure. All right, we'll jump right into the family glitch here. So at a high level, Luis, do you want me to go through the full family glitch here, or
I would let's do it. I don't see why not. I mean, It's so new to a lot of these agents are new and never had to deal with the glitch. So why don't we just start talking about the glitch and then how it's being fixed?
Okay, perfect. So at a high level, if a consumer is offered affordable coverage from their employer, the family member would not be eligible for a subsidy. And the affordability is calculated on the employee only. So let's say we're talking about a family of 4. It might be extremely unaffordable for them because it's just looking at the single employee. And so this has been really difficult in the past because the rest of the family either is not insured and just the one employee gets coverage, or let's say the whole family gets coverage and it's extremely expensive for them. We're talking like thousands of dollars per month, and they're not eligible for ACA plans because they're offered employer coverage. So this has been a hot topic, and we were super excited that a fix was just released. So what this does is it separates affordability into 2 calculations. There's one for the employee and one for the family members. Again, the employee's coverage could also be considered unaffordable. So this is really kind of opening up a lot of doors if their coverage is just not affordable. I know a lot of people can't afford to pay $900 a month, when they would otherwise be eligible for subsidies for Obamacare coverage.
And Jordan, can you I'm gonna comment on this one. Yeah. I do a lot of group insurance, and the employee affordability test, just so you know, it is based on their premium only, and it's also based on what they pay, not what the employer pays. Okay, so if their premium is $500 and the employer pays 50%, which is $250, You got to use that $250 that the employee is paying to determine whether it's affordable or not against a household income. Very rarely did this happen, guys. I mean, I don't think one time I just gave up. I'm like, I'm not wasting my time. And very rarely did I see where it was considered unaffordable. But that's all gone now. Now it's a whole nother ballpark, another ball game.
So the other piece here, so affordability, I see some people clapping. It is really exciting. It's calculated based on the premium for the employee plus the household members compared to the household income. So this was just implemented. It's for plan year 23 and beyond. The rest of this year, so if you have any special enrollments, they'll stay the same. It does apply to all states, including the state-based exchanges. So if you're writing in other states outside of the FFM, we'll just add a little note here that state-based exchanges could implement changes to their application differently. And then all changes are currently live on Health Sherpa. So here's, I've got screenshots and one more slide. So just a couple of caveats to point out here. Does not change affordability rules for ICRA or QSERA. And then the other really important piece here is that this is a regulation change, not a legislative one. So this means that the law itself has not changed, the interpretation and enforcement has. So if there's changes in leadership, they could revert back. We're hoping based on the impact that this has and how much of an issue this has been for years past, that that does not happen. More to come when we see these folks starting to get enrolled. So I think the numbers really speak volumes when the government sees like how many people are able to take advantage of this. That really helps. So I realize these screenshots are a little bit blurry, but we had done the application earlier where we got to the employer sponsored coverage section. So you can see here, you would indicate, okay, person one is offered coverage through their job. And then you would select the employer that offers their coverage. And then we ask for a phone number. I think it might be optional for that. And then would you like to provide additional contact information for employer one, excuse me, no. And then does employer one also offer coverage to these people? 2, 3. So this is just continued over here. And then do all the plans offered by employer one meet the minimum value standard? So if you're unsure of what that is, you can hover over this section that's ensuring that the plans are covering what they are required. And then here's the section where we do the math. So the cost of the lowest premium plan, just employee one, sorry, just employee. So that would be person one. And then cost of the lowest premium plan for the family will go here. And then you click continue. And this is where our site will do the math for you. We'll generate the eligibility results and we'll let you know kind of what subsidy they'd be eligible for. For anybody brand new to Health Sherpa, everything that you see on our site comes directly from healthcare.gov. It's the same data. Our site is directly connected to the federal marketplace. So you're gonna get the same results from us as you would over there.
Hey, Jordan, since this is new, and I want to make sure that I'm correct here. So when we go in there on the right side, where it says, what is the cost of the lowest premium plan that covers only the employee?
Yes.
Do we have any info on, are they going to enter the total for the employee only cost, or is it the portion that the employee is responsible for?
That is a great question. I will find out for you. I want to say it's the total, but let me just validate that because I'm not sure. This we just
I'd like to know because I know some employers pay a minimum of 50. That's what they're supposed to pay. I have one employer that pays 100% of the employee only costs. So automatically we already know that that's affordable for the employee only.
Right.
Now they pay 0 for the spouses and the family. And so the next question right below this is how much would the lowest cost health plan at employer one that covers 1, 2, and 3. So
let me get back to you, but from that example that you just used, I think it would be, let's say if it was 0 for the employee, but then maybe 800 for person 2 and 3, you would put the 800 in here, but I will definitely follow up with you.
Okay.
And I'll make sure that when you send out follow-up to everybody on the call today, that we've got the answer to that.
Okay. Remember, guys, this is new. This is brand spanking new. So we don't have anything. I'm sure in about a week we'll have something will be out there. But know that we're gonna probably we're probably gonna have to figure this out. Okay. My thoughts on this is the first question, the lowest premium plan, they're gonna have to call their employer, because sometimes what happens is an employer, when I do a group insurance, I'm looking at 20 plans. Now it's the lowest cost silver plan, just so you all know. There's a bronze, silver, and gold for employer plans. Sometimes these employees will enroll in a bronze plan. Well, that's all the employer wants to offer. They want to offer the cheapest, and that's okay for the employer. But these numbers are going to be based on the lowest cost silver plan. They're going to have to call their employer and find out, hey, what's the lowest cost? What's the cost for me? And what's the cost for my family? And they're going to have to get those rates. And I'm going to just tell you right now, they're not going to know that. There's no way. Okay. They're going to have to call their employers, or this is not going to be a one-time close. You're going to have to follow up with these people.
Yeah, it's definitely going to be a change, but as you mentioned, certainly a lot of opportunity. So this will be an easy one this year. Well, maybe not easy in terms of it's new, but an easy opportunity to definitely grow your book of business through this change in the family glitch.
Oh yeah, it's huge. I think it's huge, Jordan. A lot of opportunity here. I lost a lot of clients, and it was scary, guys, because if they actually took the subsidy, there was a potential that they were going to have a tax liability if they had access to group insurance. And, I don't know about you guys, but I don't like to have problems with my insurance. This is not a short-term game for me. It's a long-term game. And so, it is a very scary thing. I would, want them. And also, not only that, but this tax liability for these insureds could be huge.
Yeah.
So
we're definitely super excited about that. Again, if you have questions, reach out to us, Luis. I'll follow up with you afterwards. We already talked through some of the customer management information in here. So again, this is where you would go to take care of any of those follow-ups or do any binder payments. This will all be sent out to you afterwards, so you can reference this deck here. But just know that Health Sherpa is giving you all of these tools to manage your book as well. We talked about the notes here. A couple of things just before we wrap here. So troubleshooting and resources. When you're logged into Health Sherpa, you've got a question mark icon up top. The what's new guide is everything that's what's new. Pretty self-explanatory there. Try to keep that page as up to date as possible. The getting started guide is a great tool for if you're brand new to Health Sherpa. You can check out some of the quick resources we have about really just what you need to know. We went through how to quote today, but there's some other helpful FAQs in there. The Help Center is the FAQ page, which I used on our call today. Bookmark that page. If you ever get stuck, just search export or whatever it is, and more than likely we have an article on it. Multiple enrollment groups, it's all on there. You can email the support team right from the product. You can see the chat functionality down below, or you can call into them. We do have a number of Spanish resources as well. We also have Spanish speaking representatives on our team. So if you're looking for something and can't find it, just let us know. We do send a fair amount of emails. A lot of these are required from CMS related to enrollment. I would say if there's one email to keep an eye out for once you create an account, it's going to be the Health Sherpa newsletter. That's where we try to include everything new and what you need to know about each month. So we typically send that on the third Thursday of every month, and the subject line typically has newsletter in it, but check that out. Cute pup there. We'll have like upcoming trainings, anything new. So about the family glitch will be included in this new one. If we make any product changes, they're in there. And then here I've got a slide of the support team's contact information as well. So agent support is where you'll go for just basic troubleshooting. You can contact me through agency sales at Health Sherpa. If anybody needs support from an agency level, I can help with that. My email was also at the beginning of this presentation. We work with over 45,000 agents. No question is a bad question. If you need help, just reach out to us. We're here for you. We're super excited to be working with all of you. And I can't thank you enough for your time.
So go back a couple of slides.
Yeah.
Okay, I want to point out a couple of things. One more. Keep on. One more. One more. We'll get to it. Okay, guys, know that the beauty of Health Sherpa versus a direct enrollment, okay, on healthcare. You are able right there on the right-hand side, you can view the eligibility and you can view them for the past years, okay? You can find out what their incomes that they've used and documents that may have submitted in the past. The eligibility, a little button there on the right is good. Now, today I got a couple of emails, and I know on Friday, which was the 15th, I was bombarded because all these people filed extensions. Luis, I need my 1095. I need my 1095. And I'm like, I know they send it to you, but people are people. Okay. So very easy. You can click on it. You see how there's kind of in the green square. You can pull up the 1095, which is what they need to finish their tax return. You download it. It's a PDF. You can email it. You look like a champ. Also, can you go back one more, Jordan? Okay, look at this right here, guys. When you pull up a plan, you're able to change the plan if they meet the low income SCP, which is great. During the annual enrollment, I think it changes to renew, doesn't it? During OEP?
Sorry, say that again.
During open enrollment, the change plan, doesn't it change to renew?
Yeah, you'll actually have a renew button appear, and I have some slides in the appendix to share with everybody about renewals.
Okay, now if you don't see change plan, but you needed to change a plan, report a life change, guys. Do you have the report a life change button here?
I don't have it on this page, but I can show everybody where it is.
So sometimes, guys, you won't see the change plan, and that's because they're not in the income category for the low income SCP. So if there's a legitimate SCP, or a change, a life change that is happening, you would do the report a life change, and you could report on that change. And then if they qualify, they'll be able to, you'll be able to process whatever change is necessary. So just because you don't see it, don't think that it's you. It always is you guys. It's never us, right?
So here's the report changes. You can see it here, and then you can also see it here.
Right. So that's a good thing there. Okay, so I'll let you go on, Jordan. Go ahead.
Oh, that's okay. I want to make sure we have time for Q&A. I'm not going to go in detail through the renewals, but I just want to share with everybody that there is a section about how renewals work with Health Sherpa. Some really exciting things to be aware of right now is that as soon as CMS publishes the public use files, that means that Health Sherpa will be able to open up what's called window shopping. That means that the plan rates for 2023 will be live on our site. And a great tip for you, if you are working with new clients or you're renewing your book, especially with the carrier changes we're seeing this year, you can actually pick a new plan for your client and just not hit submit. And I showed you that save lead button earlier. All of those saved leads will end up here in the lead section, and then you'll be able to just click renew and submit it come November 1st. So again, helping save you some time so that once you get through all of those, you can then shift your focus to new business. Again, I was having some issues with staging this morning, but again, we will be announcing when window shopping is live. That will mean the rates are live on Health Sherpa. So we'll have a big banner up on the site when that goes live. I'm anticipating any day now. I don't know when, but it's typically the week prior.
Right. It's coming soon. Okay. I got questions here from a few agents, but can you share, God almighty, this happens all the time. I had it. Not clients, not leads. It'll come to me in a minute. Okay.
No problem.
Can you, and this is from Agent Kevin, can the PURL that agents have access to, when they utilize that PURL, what does it look like for the consumer side?
Yeah, great question. Okay, so every account is going to have this marketing section. And again, this is your direct to consumer marketing link here. So you're able to customize this page through the marketing section. So the name that's displayed, the phone number that's displayed, you can upload a logo, you can change the color palette, you can change the photo, and then we can track with Google Analytics. So if you have a Google Analytics account, you type in the code here and click update. All that this does is just tells you how much site traffic you have. But this page here is great because this is almost identical to the quoting tool that I showed you, but it's even friendlier for the consumer. So they type in a zip code. If we capture email or phone number, they'll be saved as a lead in your Health Sherpa account. I get asked all the time, can we just make those mandatory so that we make sure that we're always capturing all of that information? The reason that the only field we ask for is zip code is we just want to make sure that as many people as possible can get through this and can see that there are plans available for them. So if they click see plans and prices, just very basic information here. So they want to see if they qualify for a subsidy. Very simple to add a spouse or dependent if needed. We'll do household information. So let's do under 150% FPL. We can see what sort of subsidy we'd be eligible for, a CSR as well. They can also look at providers or prescriptions in network, and then it drops them right into the plan results. So now let's say that they get here and they're like, oh my gosh, there's 120 plans. I have no idea where to start. Your phone number is going to be displayed up top so they can call you. Let's say they pick a plan and they add it to the cart, but they don't complete it. You're going to find them back in your leads section of your account. So it's going to show you. And again, I'm so sorry, I don't have an example. Let's see if I can save this.
Complete name of medication.
So let's see if this saves for me.
Yeah, and you will get a notice if that insured fills that out. You get an email. You get that email. When I get them, I call them. Hey,
Yeah.
John, how can I, let me help you because I'm the expert.
Absolutely. So you can see I clicked on save, and then it's going to show us kind of wherever they left off. So we would recommend just reach out to them right away. You can hop into your Health Sherpa account, click resume shopping. It's going to bring you right back to wherever they were. So I stopped on the start application page. So a great tool as well.
Awesome. Okay. And we'll get into money here in a minute. Let's go to the next question from Aaron. Does Sherpa run better on one browser versus another?
That's a great question. Most of our team uses Google Chrome. I don't know if it is optimized for one over the other, but I've been very happy using Google Chrome.
Okay. Yeah, I use Chrome all the time. Okay. Next question from Jennifer. On Cobra offers 18 months after end of employment, but it's very expensive because the employer doesn't pay a penny. Okay. Do we use it as coverage ends or to verify affordability? Coverage ends, I would say.
That's an interesting question.
Yeah,
So
this is what I've done, guys, and I've never had an issue. And insured's on Cobra. I get them. They paid 1 month. They're like, I'm not paying this. Can you help me? When they terminate Cobra, that's the SCP.
Yeah, that works.
That's the easy way to do it. Okay. They terminate their Cobra, whether it's voluntary or involuntary. I don't even think it asks you whether if it's voluntary or not.
Yeah, I don't think so.
No, you just Cobra end it, lost coverage, you rock and roll.
Yeah.
And that creates the SCP.
Great question.
Yep, that's a good one. And when they're on Cobra, guys, I will tell you, people, if they're sick, they may not have a choice. And, they may need that group coverage because it's probably a PPO. And yeah, they're paying a lot for it, but it's keeping them alive. They don't have a choice. But when they do have a choice, then of course ACA is a great option.
Or maybe they've hit their deductible and they want to continue it through the end of the year. There could be a number of reasons that they want to continue that coverage.
Yep. So, yep, definitely. Okay, I think we're done on the side questions. If any of y'all have any questions, guys, just unmute yourself or type them away. Hit her up. Stump her. Why don't we try to stump her? Come on, guys. Somebody's got some good questions.
Come on, it's Monday.
Anybody? I don't want to hear any crickets. I have a cricket machine. I can pull out the cricket machine and play it. Come on, guys. I know somebody will ask a question. Come on. Don't leave me hanging, guys. 25, 26 of you guys, somebody should have a question. I had a question. I still can't. The question I had in my mind is it's gone. I mean, I'm trying to think of what it was. It was a good one.
What I will add is that for any of you that are brand new, please don't feel overwhelmed by what I went through today. Health Sherpa is very simple to use. You're going to love it. We'll make sure that you have a link to join a training with our team. If you can't join one of the training times, I know it's a crazy time of year. We can provide a recording as well. You can always register for something that you're interested in joining. Even if you can't attend, we'll send you the recording and the deck afterwards. So just know that you have access to so many resources with us.
I found it. Question.
I'm ready.
Popped up. Here we go. Woo-hoo. That's what happens when you get in your 50s. Man, things go. The good thing is it came back. All right. When it's gone, then oh yeah, then you got other problems to worry about. Okay. So money guys, last year, it was really, really cool that if you wrote a plan, you got your commission, of course, and you got carrier bonuses, but even you guys were offering a bonus.
Yeah, great question. I'm so happy you're on.
Think about this.
Okay. So earlier in the call, I told you during account creation, you can opt into our referral program. It is optional. We also offer broker bonus program. So let me just help distinguish between the two. If you refer to Health Sherpa is agent of record on those policies. Again, we don't contact your clients, but we would get paid the commission on that and you get paid a bonus. I want to say it's $120 during open enrollment, and then it drops down to $50 during special enrollment. Broker bonuses are separate from bonuses that you would get from a carrier. You are agent of record, but this is simply a way of the carriers paying you extra for using Health Sherpa. It is a thank you for using Health Sherpa. So the way that you find these is the bonus tab. You go to broker bonuses, and then you can see what carrier it is, what the offer is, and then the states, if it's on exchange or off exchange. I don't think we have any off exchange right now. And then you can see the full details of it. But the reason it's in this tab here is because when you write the policy, you'll be able to track the submission down on the bottom. So you'll be able to see how many you've submitted, the total paid, and the total value. That reporting that I pointed out earlier will also track any bonuses tied to it. It's all the way on the far right of that report. The only time that you're going to get money from Health Sherpa is if you participate in the referral program or the bonus program. Once you've submitted something that you are due a payment, you'll actually see a yellow box appear that says, we need a W-9. So you'll upload a W-9 in here, and then we'll be able to pay you. We can send you a check or we can do direct deposit. It comes from bill.com. So don't think that that's spam. It really is our team. If you're not sure, I know I've said this a million times, but call us. If you've submitted broker bonuses and we're still waiting for that W-9, our team is going to reach out to you asking you to give us that information so we can pay you. But if you see, the total value is like $2,000 and you haven't been paid, it's probably because we need payment information. So again, broker bonuses can be found in here. We'll tell you the states that they're running in, what the bonus is. I don't believe there's any caps on these either. So, if this is a good plan and it's a fit for your clients, it's again, another way for you to make additional money. Last year, the average agent made an extra $1,000 from this program.
Yep. And I will tell you, once the money's gone, it's gone, and you'll see that little bonus thing go away. So it's not like, oh, where did it, it's there for when it's there. And I'm guessing that you guys get a chunk of change from that carrier, and then that carrier, then you guys, when the agents use it all up, it is gone. So
it's gone. Yep. Definitely take advantage of these if you see them. So just check this section every once in a while. Because we're in here, I'll point out the associates section. If you know any agents that are not using Health Sherpa, I want to point out, if you know somebody that is concerned about Health Sherpa, if they think we're going to steal their clients, if they had a bad experience with us in the past, please put them in touch with me. I'm happy to take those phone calls. I'm happy to ease their mind, but you can absolutely invite agents through your Health Sherpa account. If they participate in our referral program, you'll get paid $10 every time they submit a referral. You can't view each other's books of business. You don't have visibility into each other's account. This is truly a word of mouth referral program.
Not a bad deal. So it's a good thing. So that's what I wanted to share with you guys, because you're right. It's just extra money. And you're right. The bill.com, I got that. I was like, screw it. And then I was like, where's my bonus money? And that's because you have to set up your bill.com deal.
Yeah, absolutely.
Super easy to do. Okay. We got one more comment here, and I think I can answer this one, but mother and daughter were declined Medicaid. So she clicked on the button, denied Medicaid in the quote.
Okay.
And then when the application, it forced the daughter. Okay, I know what happened. So just because you clicked it on the quote, you also have to go on the application, and in the additional question section, there is a question that says, were any of these people denied CHIP or Medicaid? And you would pick the appropriate person, click on it, and put the date that they were denied. So you got to do it in the quote, but you also have to do it in the app section.
So if you ever get stuck using the quoter, there's basically two pathways to get your client through. If you get stuck here, click start application and just get through the full application with them. Put the mother and the daughter's information, click that button that they were denied coverage. You'll put in the date. This application is what is going to generate the eligibility results. And that is what matters in terms of getting them enrolled. The quote is simply a quote. It's not looking at their full household picture. So if you ever have an error come up on that page, just go right to the application and fill that out.
And okay, perfect. So you did that too, and they said it didn't matter. They would review, and okay, yeah, you might have had a glitch. Normally, when I go in there and I put the date of, now I've had times where I've had to submit documentation, and then I've had some where I didn't. So it's going to be dependent. You're not going to know specifically when that scenario happens.
Let me show you guys another cool tip here. So let's say you click on the start application and you know that you just have a unique circumstance, or like you get an error message on Health Sherpa and our team says, okay, call the marketplace. Another kind of fail safe you can use is what we would call the backdoor, which is this redirect right here. So I clicked on start application. We don't see this needed often, but know that it is here. As an agent, you can log into healthcare.gov and you can process the application, or you can look things up on healthcare.gov. So if you have like a really unique tax household and you're getting an error message on Health Sherpa, click this use our healthcare.gov redirect, and you can try to do it yourself over there before calling the marketplace. The other piece I will add about doing that is if you do the application over there, all of that data will come back to Health Sherpa. So you'll still have access to all of the tools that we talked about in terms of like managing your clients, all of your reporting, all of that. So whenever possible, we're trying to just keep you right in Health Sherpa.
Okay, a couple of more questions popped up here. The low income SCP, Kevin, we don't know if it's, I haven't seen any notices that it will be extended for 2023. My guess that if it does, it'll probably come out sometime in January because OEP is ended. So, yeah. but this low income SCP was only for 2022. So you know anything about that, Jordan?
I haven't heard anything. I think your guess is probably the same as what I would say it would be after open enrollment if they extend it. The one piece I will point out is folks always get confused about the income bracket. It will, so for next year, if they do extend it in 2023, it will go off of the FPL chart of 2022. It's always the year prior. It's not the current year. So this past year, we're looking at 2021 data, not the current year.
And, you know, just so you guys know, Health Sherpa is going to work in the FFM states, the federal facilitated marketplace. I've shared with you guys the map. So it's the majority of the states, but state-based exchange, what are the, you know, they got to go, you know, in that scenario, guys, unfortunately, I think there's 14 states and there they are, beautiful. Those states, and there's covered California, or California, I'm getting something there. Those, you can't use Health Sherpa, right?
You can't, not at this time. I'll point out that you can. So if you see a, I'm trying to look for one, a state-based marketplace federal program, here we go, Virginia. That means you can use Health Sherpa, but if it's just a true state-based marketplace, you cannot. So this page here on Kaiser Family Foundation is linked in this OEP prep guide. So you can see, do you plan to write in a state-based marketplace? If you click on this link, it'll show you the full list.
There you go. So I will pull that up and yeah, we'll go pull up that OEP. Are you going to email me that, or where do I get that?
Yeah, I'll email it to you. Okay. This OEP prep guide, just one little note here, again, was in this getting started. So in the agent checklist, it's in English and Spanish. I don't know what this link is here. It's a Monday link.
Could you copy and paste it real quick on the chat? Yeah. And that way we'll have it, and then I'll share it with the agents again. But guys, you got to get ready, guys. We're a week away, and this is not a marathon. Okay. Yeah. I will tell you that. Definitely not a marathon. This is a race. Okay. So we've got 70 something days. I don't know what the math comes out to, but November the 1st through January the 15th. Now, as far as dates are concerned and effective dates, 11/1 to 12/15 is a 1/1 effective date. 12/16 through January 15th will be a 2/1 effective date. Okay, I had agents asking me, they wrote them 12/31 and they thought they were going to get a 1/1 effective date. Not going to happen, guys. So, and then after January 15th, we don't know what's going to be out. There's going to be any special elections. Here's just my professional guess. Okay, this is a Democratic product. We're in a Democratic administration. With that being said, probably going to get a lot of things that enhance that. Okay, we go into a Republican administration, probably going to get restricted again. So again, those are political things that we can't control. That's just my opinion, not political opinion, just my observations. So my guess, we'll have something for 2023 beyond the open enrollment. That's just my guess. Okay. So stand by.
Yeah, more to come on that.
Oh, yeah.
I dropped a few things in the chat for everybody. So the first one that says app.box, that was that open enrollment prep guide. Again, that'll be linked in the presentation that we'll share. I also dropped in the agent support phone number and email address. And there are 2 Zoom links that I popped in there, which are also included in that open enrollment prep guide, as well as my presentation. There's a What's New webinar that our team is hosting. I think we've switched to bi-weekly now. So for anybody seasoned on Health Sherpa, that's a great webinar to just learn what we've launched this past year. And then the last link is our Health Sherpa agent training. So if you're brand new and you've never used Health Sherpa, definitely sit in on one of those and we'll teach you everything you need to know. And
I got a pro tip. Okay, now this is another thing that I had in my mind that I lost. Okay, you can hit, and when you're looking at all your clients, somewhere in there's a renew button. And you can email your entire book with a matter of click, click, click. And they get an email from you stating, do you have a copy of that renewal email?
So in the deck, there's a little bit of information about renewals.
Okay, but just so you know, great feature, guys. I was having my staff do it every day to everybody. I don't even care if they enrolled. They were like, I already enrolled. Perfect, I love you. By the way, you don't have this or this. It was just another way to communicate with them. And it was another way for me to tell them, Jordan, you better not talk to anybody else. Okay. Do not talk to another agent. You're mine. Okay. Don't screw up. And so I was just every day, it was frustrating, but I would click it, or my staff every day would click renewals.
Yeah. Just a great tool to get in front of your clients. Again, sending them a link. You have the option to give them a link to renew on their own. If you don't want them to do that, you can remove that link and you can just update the text to say, hey, call me, schedule an appointment. Let's make sure that we talk about your plan for next year. But you do have the ability to email everybody in bulk from Health Sherpa. Those slides are in the deck, which will be shared with all of you. And once that window shopping period opens up, you have the ability to start using those renewal features.
Okay, so Denise, 12/16 to 1/15, 2/1 effective date. That is correct. Okay, now this is the nasty side of our business. Okay, get ready, guys. You all should be like, what? Nasty side. AOR changes. It happens, guys. All right, you can't control it. I would just say it's part of the business. Just roll with it. You're going to be doing it to other agents. Okay, it's just the way it happens. Jordan, where on the screen can they tell if they're still the agent of record?
Great question. Let me share my
screen.
screen.
It would be awesome if you guys developed a tool that would let us know when the agent of record changes.
That has been a very common feature request. I don't know the full why behind why we haven't launched that. I will tell you that with the amount of volume that goes through our site, more often than not, when we have an angry agent calling us because they think their client was stolen, it's because their client calls another agent and works with another agent. So it's hard because it's like that client elected to work with somebody new, and it's not always an agent being a bad actor. But that being said, we do give you some tools to be able to monitor for this. So as you grow your book of business, the first one I would recommend using is this export. Again, let's see if I can pull up the legend. The export legend is going to show you what the agent of record is on the it's not going to tell you the name of another agent, but it's going to say other party if it's not you.
Right.
So you can find that in this section here, and the NPN used as well. Now, if it's blank, because that does happen from time to time, let's say a client calls you and they said, hey, I submitted my app on healthcare.gov. You know, I'm all set, but I want to work with you. And you use the search marketplace on HealthSherpa. And you look up, let's see if I can find an example. You look up their information, you attest on HealthSherpa that you got consent to work on their behalf, and you want to add them to your dashboard. Just adding them to your HealthSherpa account does not make you agent of record. Let's say they did it on their own, or maybe they worked with a different agent last year. You have to resubmit their policy to have your NPN attached to it. Again, you can use that backdoor that I pointed out earlier to go over to healthcare.gov. I know some agents will check on healthcare.gov if there is a NPN on the record. If I can get this page to load, this is the other place you can go to check for agent of record. So let's say, okay, this isn't going to work with me today. Let's say we go back into Joe's example from earlier. Once this loads, we'll be able to see that my NPN is on the record. Every time you click into a client on this page, HealthSherpa is doing what's called an API pull from the federal marketplace. So we're pulling the most up-to-date information. So you can go in here and you can check this. The reason I say leverage the export report first is I don't want you to have to click into every single one of your clients constantly. Leverage the export report, look for anything that jumps out. If you see another party on one of them, maybe come in here, and that's when you would click on their name and you can see the status. So this would say other party right here if it was no longer me.
And it would be in red, very noticeable. And, or you may see no AOR.
Yep.
And you're like, I wrote this guy. I wrote Jim. What the heck happened? I will tell you what happened. Okay. Usually they called the marketplace and that freaking rep, God, I get so mad at them. But I don't know why. It doesn't even hurt them. But I have experienced it. They remove you and the NPN. Maybe they're being mean or who knows why, but or maybe the insurance says, no, I don't want to work with that agent. Take them off. So know that happens, guys.
Yeah. So again, we have the tools in here for you to be checking that. If you have questions about us, certainly call us. If you see in here, it says something like agent referral, you referred it to HealthSherpa. So again, if you did that by mistake, what you'll want to do is the referral program, again, is managed in this bonus section. If you have it turned on, you got to come in and you need to manage your states and appointments. So you add the states that you're licensed, and then I have the referral program off right now, but if it's on, you select which carriers you refer. The other piece I will call out is that if you submit a referral to us, before you submit it, it says, you're referring this application to HealthSherpa. Are you sure? So we try to prevent you from making those mistakes. But if you do make a mistake, just go back in. If it's during open enrollment, just resubmit it. If you realize this like 3 months later, first thing I'm going to say is should have been checking your reporting. Second thing I'll say is, okay, we'll help you through it. So just call us if you need help and we'll walk you through it.
Yeah, they will, guys. They're great. And again, if you're appointed with a carrier, do not check the refer button.
Yeah.
Okay. Now, Mike, if they're using the PURL or if the agents are actually quoting, if they have either appointed or referred check off, it will show up in their list of carriers on that quote, right?
So last year, CMS made a change for all EDE entities where we are required to show all plans in a given zip code, regardless of appointment status.
Okay.
This is where the referral program kind of comes into play, in that, like, if you're sharing this marketing link externally to your clients, they could potentially pick a plan that you're not appointed with. So that's where I would say opt into the referral program, because you might as well get paid $120 versus $0. And then if you get, if you start seeing a lot of traffic with that particular carrier, you should reach out to that carrier and say, hey, give me a contract. I want an appointment. And you could get that, later in the year. And then you can write that business for commissions the following year. But if they enroll in a plan that you have set to refer, it would reflect whatever the settings are in here. If you're appointed, it'll just go direct as it would if you were submitting the application. But again, if you don't have the referral program on, they could potentially enroll in a plan that you're not appointed with. If you are using the reporting, you'll see one that they enrolled in a carrier that you're not appointed with. So you can either contact them and say, hey, like maybe you can work with them on picking a different plan, or you could just go in there and make sure you update your settings and then resubmit. Again, just call us. But all of that is managed in the carrier section here. If you're running a quote for a client and you only want to show them plans or carriers that you're appointed with, once you get to the actual quote, you just want to use the filter on the left-hand side that just shows all the carriers. So let's say 19,000. We're just going to scroll all the way down and we just pick the carriers. And now we're only going to show the client, let's say you're doing a screen share, only the carriers that you're appointed with. So this is another great tip.
Will the clients that are referred out or use the PRL and pick a plan that they're not set up with, will they still show up on the client tab for these agents?
Yes, absolutely. They'll show up on the client tab and they'll show up here in the, let's go back, in the referral section. So just like those bonuses, they're going to be listed down below. So we can see the name, the carrier, the status of the payment with us, and the amount.
So there you go. So down the road in the following year, you can get them back, get appointed with a carrier if the appointment is available. And there are some carriers, guys, that don't appoint agents. There's some captive carriers. There's some, like I have one here, community, that doesn't, I've never heard of an agent being set up with that one, nor do they appoint agents. So I guess it's just a direct. So you'll run into those every now and then.
And this is a great program to leverage if you're new in a market. Let's say you add a new state and you just don't have any appointments yet. You can absolutely use this. We see a lot of agents leveraging this program for many different reasons. But again, the reporting is a great tool after open enrollment. You can go in and look at, one carrier and then reach out to them and say, okay, I wrote 150 apps with you. Give me an appointment. So you've got all that data.
Mm-hmm. Yep. I know one carrier that was, they were a larger one and they were like, hey, if you don't put enough with us, we may term you. And I didn't see any terms, but yeah, they at least warned agents that, if you're just going to write a couple, they just didn't want to deal with you. They wanted production. Well, this has been awesome. Guys, any more questions for Jordan? I think we stumped her. Did we stump her on what? No, we didn't stump her. I don't think we did.
I owe you a follow-up on some of the family glitch, but
yeah. Well, we'll give you that one because it's so new. All right.
It is new.
We'll give you that one. No biggie on that one. Okay, guys. So get ready. If I get any data on the family glitch, I'll let you know. But do know that here by November the 1st, something's going to be fixed. So stand by and it'll be integrated into Health Sherpa. So we'll know what we need to do.
Yeah. Thank you so much for having me on today. I wish all of you a very successful season. Just know, again, we're here for you. I'm here for you, and happy selling.
Yep. Thank you, Jordan. We'll be doing this again soon. All right.
All right. Sounds great.
Okay,
bye, everybody.
Thank you. All right. Bye, guys.